Yeah, first of all, I would also like to congratulate both BPNI and PHRN for this excellent report. It's a tool that has been very powerful and useful not only in India but also other countries. So I'd like to commend them for this excellent work. I think it's a very, very good report. And UNICEF is honored to be part of this August meeting. It's a great pleasure and honor to be here. And I'd like to build on the comments that were also made by Dr. Ajakera and Ms. Deepika on, the areas where UNICEF, to add in the areas of where UNICEF could play a role to support this important initiative on IYCF. As the presentation highlighted, there is a number of low-hanging fruits. I think those are areas that will, that we would be very happy to contribute towards. And one area that I think is very important is the progress that has been made on the exclusive breastfeeding rate and early breastfeeding initiation. And that's, very much in line with the Ministry of Health's focus on, promoting institutional deliveries. So early breastfeeding initiation has doubled. I think that's very important to recognize. And also, exclusive breastfeeding rate is at 65%. And those two are now globally recognized as one of the most high-impact interventions for mortality reduction. Early breastfeeding initiation can reduce neonatal mortality by 22%, and exclusive breastfeeding by 13% of child mortality. So I think it's one of the very important initiatives in that regard. So I think an area where it will be very important to understand is, given that institutional delivery is as high as 80%, what are the barriers? And why the gap? So we have only 45% that are initiating breastfeeding early within the first hour. And based on that understanding, look at the role that BFHI can play to strengthen the facility capacity, to follow the 10 steps. So I think this is an area where we could look at, and it's also an area that I've worked extensively in other countries. So we'll be very delighted to work with the Ministry of Health to look at, reviving the BFHI package. And again, I think one of the lessons learned in BFHI is to look at it as an integrated approach. So look at also the mother-friendly initiative with the BFHI, so that the mother and child is looked at as a dyad, and both at the facility and the community level. So I think those kind of experiences that we have learned from BFHI and previous country experiences can be drawn and see how that can be strengthened, and also how can we make it sustainable so that it becomes part of the standard healthcare practices, and the assessment can be then internalized so that it's not dependent on external support. So I would give this as a very high area of focus for UNICEF, and we'll be looking very much forward to working with the Ministry of Health and all the partners. Another challenge is complementary feeding, and this is an area that will need focused attention to also identify what are the concerns. So the first thing is to look at quantitative data, to find out what are the main determining factors that are deterring, improvements on complementary feeding, maternal factors, child factors, education awareness level, and also qualitative data, looking at the, available complementary foods, and then, see what kind of simple messages can be disseminated to promote, the foods that are not being provided to children at this point. The second area that I think will be also important, it was also mentioned during the presentation, is on the standard package, harmonized package. I know BPNI has extensive experience on developing the 4-in-1 curriculum, and I know that there's also other partners. How can we work with Ministry of Women and Child Development, Ministry of Health, to develop a package that is harmonized nationally, that is looking at, providing knowledge and skills, counseling skills, mentoring, supportive supervision, so it's effective. So it needs to be coupled with knowledge management to identify a package that can be effective. I know we've had initial discussions with some of the key partners, but I think I agree that this is an area that needs to be pushed and would be giving that attention. And I also agree that it needs to be looked at in a comprehensive manner. So look at it in the development context as well as HIV and emergency context, as in line with the global IYCF strategy. A third area is on IEC. Dr. Kira also mentioned there are a number of IEC materials. So what UNICEF is engaging on is on public advocacy and communication, working with telecom partners using innovative approaches so that the ASHA's Angari workers can be provided with tools that can enhance their counseling and interpersonal communication skills. So, and I think this is also another area that we could look at. Again, as part of the initiative to reduce stunting and also as part of the maternal, infant, and young child nutrition strategy. So I think IYCF could be a core component. And finally, on partnership, it's quite clear that it requires a host number of partners if this effort is to be successful, starting with professional associations, pediatric association, OBGYN, recognizing that mothers need to know about breastfeeding during pregnancy, how to make sure that this message is also going through ANC visits during delivery, postnatal, as a follow-up. With medical colleges, I know there's also been work already done with medical colleges to make sure that it's part, as Dr. Vandana mentioned, that it's part of the curriculum not only for the nurses and paramedics, but health workers, but also for the physicians, for the doctors. So to make that as part of the core curriculum, working with NGOs, development partners, and then government at the national and state level. UNICEF is working now with 14. We have states to include IYCF into the PIP and to strengthen the capacity. So I think, at the state level, what kind of mechanisms can be established so that, breastfeeding is promoted, supported, and protected. So again, thank you for this opportunity. I think it's a very, very important initiative and report, and look forward to working with all key partners to continue to move the agenda forward. Thank you very much.